Hello, my name is Bernitha Carter, and my partner is Tara Casillas. Welcome to our presentation on Bernitha Orem's self-care deficit theory and how it applies to advanced practice nursing. Today, we'll introduce the theory, explain its key components, and walk through a case study of a 67-year-old woman from an advanced practice nursing perspective. Our goal is to show how this framework helps nurses promote patient independence and improve patient outcomes. Before we dive into Orem's theory, let's talk about why nursing theories matter. They give structure and meaning to what we do. They're like a roadmap that explains the why behind our actions. Theories also support evidence-based holistic care, making sure we address not just physical needs, but emotional and social ones too. They improve decision making and patient outcomes by guiding consistent, informed choices. Plus, they help us connect classroom learning to real world practice, which is essential as we transition into advanced practice roles. For advanced practice nurses, theory isn't just academic, it's the foundation for managing complex patient needs and promoting independence. Now, let's take a moment to talk about Bernitha Orem, the theorist behind the self-care deficit theory. She has become one of my favorites since taking this class. She was a major contributor to modern nursing science and lived from 1914 to 2007. Orem developed her theory over several decades, from 1959 to 2001, with a strong focus on patient autonomy and independence. She believed that every individual has both the ability and the responsibility to engage in self-care. The idea was groundbreaking at the time and continues to influence nursing practice today. Her work gives us a framework that empowers patients and guides nurses in promoting independence. Now here's an overview of Orem's self-care deficit theory. The theory explains when nursing care is needed and how nurses can support patients who cannot fully care for themselves. The model has three main components. Self-care theory, which focuses on the patient's ability to meet their own needs. Self-care deficit, which occurs when those abilities fall short. And nursing systems, which describe how nurses intervene to help restore or maintain independence. Understanding these three components gives us a structured approach to assess patient needs and plan care effectively. Now let's talk about self-care requirements. Orem's theory identifies three categories of self-care requirements. The first is universal requirements. These include basic needs like air, food, water, activity, and rest. Next are developmental requirements, which relate to life changes such as aging or adapting to new roles. Finally, health deviation requirements, which occur during illness, injury, or medical treatment. Understanding these categories helps nurses assess what self-care demands are needed for any patient and tailor interventions accordingly. Orem's theory outlines three nursing systems that guide how we support patients based on their level of independence. The first is the wholly compensatory system, where the nurses provides complete care, often in acute settings when the patient cannot perform any self-care. Next is the partially compensatory system, where care is shared between the nurse and the patient, such as during short-term recovery or home health situations. Finally, the supportive education system, where the nurse teaches, guides, and empowers the patient to manage their own care. The ultimate goal is always to move patients toward independence whenever possible.
Hey, I'm Tara Casillas. I want to present our case study now. Let's meet Mrs. L, the patient in our case study. She is a 67-year-old woman recently diagnosed with type 2 diabetes. She lives alone, she is retired, and she does report fatigue, poor appetite, and difficulty using her glucometer. In addition, she has some osteoarthritis in her knees. Of course, this limits her mobility. We chose Miss L because her situation illustrates how Orem's self-care deficit theory guides clinical reasoning for APRNs. Her combination of chronic illness, functional limitations, and emotional challenges make this a great example for applying this theory. Next, let's identify Mrs. L's self-care concerns. Number one, she struggles with inconsistent glucose monitoring and she doesn't understand counting carbs, which makes managing her diabetes very difficult. She also has a fear of hypoglycemia. This adds more anxiety to her daily routine. Her joint pain keeps her sedentary in her life and she's experiencing a low mood and social isolation. According to Orem, a self-care deficit occurs when a person's ability to care for themselves doesn't meet their care demands. These findings show deficits across universal, developmental, and health deviation requisites. This guides us toward the right nursing system for our patients. All right, now that we've identified Miss L's concerns, let's determine her self-care deficit. She has challenges managing her chronic illness. She has challenges planning nutrition, maintaining mobility, and building confidence. In Orem's terms, her self-care agency doesn't meet her therapeutic self-care demands, which creates a clear deficit. As APRNs, we recognize that her abilities are partially compromised, so our focus will be on supportive and educative interventions to help her regain her independence. All right, so for Miss L, we selected the supportive educative system. Why? Well, Miss L is motivated, she's cognitively able and eager and to maintain her own independence. This approach allows us to focus on teaching, coaching, and structured follow-up. By empowering Miss L with knowledge and confidence, we can help her manage her diabetes effectively while promoting long-term self-care. Now that we've identified Miss L's self-care deficits, let's look at the interventions guided by Orem's theory. First, we'll teach her how to use the glucometer correctly, ensuring that she does feel confident in monitoring her own blood sugars. Next, we'll create a simple, realistic meal plan to support her nutritional needs. Providing diabetes education is key, covering topics like carb counting and recognizing the signs of hypo or even hyperglycemia. Because her arthritis limits mobility, we can refer her to physical therapy to improve her joint function and help reduce her pain. We also assess her mood and screen for depression, since emotional health impacts our self-care. Finally, we'll schedule follow-up visits every 4 to 6 weeks to reinforce progress and adjust the plan as needed. Each of these steps strengthens her self-care agency and moves her closer again to her own independence. Now that we've implemented our interventions, let's talk about what success looks like for Miss L. So within 3 months, we would expect to see measurable improvements for her. First, her hemoglobin A1C should decrease. Of course, this indicates better blood sugar control. She'll be performing daily glucose checks confidently and making healthier food choices based on the meal plan that we created together. We also anticipate improved joint mobility through physical therapy, which will help her to stay active. Finally, we hope to see a boost in her confidence and a reduction in depressive symptoms. These outcomes do reflect Orem's ultimate goal. That's to empower patients to become active participants in their own care. So how self-care deficit model supports the APRN role? Orem's theory aligns perfectly with the APRN role, especially in preventative care and chronic disease management. It encourages patient-centered care, and provides a structured way to assess self-care abilities and deficits. For example, as APRNs, we start by developing an individualized care plan based on the patient's unique needs. We would then perform a thorough assessment looking at strengths, barriers, and knowledge gaps. Education and coaching are key parts of the supportive educative system, empowering patients rather than creating dependency. Collaboration with interdisciplinary teams like physical therapy, social work, and dietary services reinforces our plan. Ultimately, this model helps us prepare patients for long-term self-management, and this is essential for promoting independence and improving outcomes. Okay, so first of all, we do know the little person man in our picture is put together completely wrong. We just assumed he broke his back and is getting better and healing, and he's reflecting. As we wrap up, I want to share a quick personal reflection. Orem's theory really matches our own personal philosophy of empowerment. It encourages patient independence, confidence, and partnership. For both Kelly and I, this framework will guide our future work, especially in women's health and gastrointestinal health. It reminds us that nursing isn't just about treating illnesses. It's about helping our patients take control of their own care, feeling confident doing it, and feeling great. Thanks for a wonderful semester. We hope you enjoy our presentation, and we hope to see you next semester and hear from you too. Have a Merry Christmas. Bye.